Welcome back to KPRC 2+. While summer is a time for vacation, it can also be time when kids spend most of their days watching TV, playing video games, or texting on their phones. Yeah. A combination which doctors say could contribute to vision problems like myopia, also known as nearsightedness. I hope I'm saying that right. I know nearsightedness is right. That's because right. I'm nearsighted.
And we'll get clarification from the doctor in a moment. There are ways to reduce the risk and whatnot, and we're going to talk about early intervention, about staying off the screens. We've got two special guests with us, Dr. Nathan Bonilla-Warford, better known as Dr. Nate, and actress, fashion designer, mother of two, Haylie Duff from Houston. Good morning, both of you.
Hi, how are you guys?
Morning. We are great. Thanks so much for being here. Doctor, let's start with you. Myopia, are we saying that right? Talk about the factors that contribute to it, symptoms and whatnot.
Yes, absolutely. It is myopia. That's right. It's also known as nearsightedness. Myopia is a disease where the eyes actually grow too fast. They actually stretch too much, and it makes it blurry in the distance. So kids have a hard time seeing far away. Typically, you would see kids with glasses so they could see the board at school.
And are there anything that we know about right now that increases myopia in children? I mean, we're talking about screens. Is that one of the early impacts?
Yeah, so the thing about myopia is it's an exciting time because we're doing lots and lots of research to help reduce the likelihood and the severity of myopia. And the earlier that you get it detected, the earlier you get it treated, the better. There are lots of different treatment options that are available that doctors can tell you about, but what parents can do is, number one, make sure their kids get outside. If a child spends 76 minutes a day outside on average, their likelihood of getting myopia is reduced by about 50%. And the less time they spend on devices, indoors doing close work, also that helps out a lot.
That's not a deterrent enough, right? That's good to know, Doctor. Haylie, let's get to you. How did you know you needed to intervene on your kids' tech time? Can you tell us more about your Screen Staycation this summer and how you're encouraging your kids to spend more time outside?
Yes, well, you know, the Screen Staycation campaign really is all about getting kids outside more. You know, kids in these hot summer months, they're spending more time inside, more time on their devices. I have myopia myself, and I know that it can be genetic, and so we in my family are really trying to be proactive about implementing positive changes into our kids' daily device routines, as we know that early prevention really can be critical. So we're taking the tech time out. We are also taking this time to schedule comprehensive eye exams. That's something we don't always do with our kids at a young age. So we're getting those exams scheduled, and I'm going in prepared with questions to talk to our eye doctor about new treatment other than just glasses and contacts.
And as a mom, I mean, what are some of those questions that you and other moms really should be asking the eye doctor during the child's eye exam?
Well, it is great to go into these appointments prepared with some questions. So some of the things you can ask would be things like, what are signs of myopia that I could be looking out for? How often should we be getting in for these eye exams? And then if your child is diagnosed with myopia, there's treatment options. So what are those options? And what are they outside of just the traditional, you know, contact lenses, glasses, things like that? Okay. There's a whole list that you can find of these questions on the myopiaawareness.org website. So if you want to go in, there's more questions to look at and lots of information.
I'm glad there's a guide there. I need to print that out and take that with me. Dr. Nate, what can parents do what can folks do to reduce the risk of myopia in their kids, or at least limit the disease's progression in their child?
Yeah, so the most important thing is to make sure that they have eye exams earlier, because sometimes we can actually detect future progression, meaning it may not be happening now, but we think it's going to happen. Definitely a child should have an eye exam every year, you know, while they're in school, because vision can change really quickly. And then watching them for those sorts of signs. Are they getting really close to the TV? Are they starting to squint? Do they kind of like look out from the corner of their eye in weird ways? Those can all be, you know, signs that they're having having potential issues, and just the same thing, making sure that they're getting outside, getting some exercise, taking breaks from the screen time.
I mean, and do we know, Doc, like how much of this is just genetics versus how much, you know, we're not doing our children any favors by letting them, you know, hold a tablet right up to their faces?
Well, we used to think that all of it was genetic, but, you know, there was a study that showed that just in 30 years' time, the amount of myopia in the United States increased by 70%. So that's not purely genetic. There's a huge environmental component, and that's been seen all over the world. And especially with the most recent, you know, pandemic and increased screen time, this is going to be a big factor for children now and children to come.
Couldn't come at a better time when all the kids have the screens in their faces right now. It's extra incentive for the parents to be proactive and say, let's go talk to the optometrist, see how everybody's doing, and then be proactive going forward, limiting that time.
Those questions you were talking about.
That's right, and I think I'm the only one who still prints things out for the record. Everyone else is like, what are you talking about? What's a printer?
No, but you're limiting your screen time. That's good.
Dr. Nate and Haylie Duff, thanks so much for being with us this morning and spreading this awareness. It's so important to have.
Thank you for having us.
Thank you.